My name is Kylie Christensen. I am redoing the skill central line dressing change with Nightingale College. I'm in my uniform with my badge, no jewelry. I only had one kit for the central line dressing change, so I'm going to do my best to verbalize what I wouldn't do. The Tegaderm, the covering got destroyed as I tried to peel it up off the fake skin, so bear with me. But okay, I'm gonna begin the skill. So I would knock on the door. Hi, my name is Kylie. I'm here to do a central line dressing change. I'd verify the patient with 2 patient identifiers. Can you verify your name and date of birth? Awesome, thank you. So I'm here to do a dressing change on your central line. Are you okay with that? Awesome. So I would perform hand hygiene, and then I would offer a mask to my patient and myself. If there's anyone else in the room, I would also, N95 is not necessarily necessary, but we only had this and that, so that's what we're doing. If anyone else is in the room, I would ask them to either step out of the room or place a mask on to keep the environment aseptic to avoid infection. I would do hand hygiene again and then place on my gloves. Then what I would do is remove the dressing. When I remove the dressing, I want to make sure I stabilize the catheter with my non-dominant hand, and I'm going to peel against or with the skin, peel up the corners, and then I would peel gently, making sure I'm not pulling the catheter off. Okay. Then you would dispose of this. I'm going to be reusing this, so I'm going to put this in my sterile kit. Obviously, this is not what you would do. You would have a brand new sterile one. I don't, so we're going to pretend like that was it. But I would put that in the trash. I would not reuse that. Then the next thing I'm going to do is I'm going to inspect the site. I'm going to look at the tubing to make sure there's no kinks or breakages or clogs. I'm going to look at the site, look for redness, swelling, inflammation, or anything that isn't normal. I would ask the patient if they're feeling any pain or discomfort in the area. They say everything feels good, everything looks good. So then I would clean the site. First thing I'm gonna do is I'm gonna remove my gloves. I'm gonna throw them in the garbage where the old dressing was. I'm gonna wash my hands, perform hand hygiene, and then I'm gonna open my sterile dressing kit. First thing I do is get out the sterile gloves, only touching the outer edge. Then I'm going to start by pinching the cuff. Same thing on my other hand. Only touching the inside. Okay. I'm going to interlock my fingers and keep my hands above the sterile field, not putting them below me. After that, next thing I'm going to do is grab my gauze and the chlorhexidine, which is right here. Chlorhexidine I'm going to squeeze, crack, and I'm going to let this fill up with the chlorhexidine. And chlorhexidine, you want to use friction. So you're going to scrub back and forth for about 30 seconds. So I'm going to go ahead and grab the tubing, lift it up without pulling on it. Then I'm going to use friction on the skin, 30 seconds. And I'm going to clean the size of the dressing. After I've done the 30 seconds, I'm going to clean the tubing, bottom and top. I'm going to set that down. I'm going to let everything completely dry. Once everything is completely dried, then I'm going to go ahead and apply the new dressing. So this dressing would ideally be unused in a real setting, and it would come in something like this. So you would go ahead and peel this off. This would be trash. You would take this and place this over the dressing, like so. Smooth it out. This would be on the top, like so. So you would press it out so there's no bubbles or raised, making sure the catheter is nice and secure. You would then peel this part off. Once you peel this part off, you're gonna take the part with the name and the date. You would initial it, write the date, time, and gauge of the catheter in there. Peel off that strip. Place it here on the edge so it's not covering up the catheter. After that, I would clean up all of my supplies and throw them in the garbage. Remove my gloves. Perform hand hygiene. Remove my mask. Ask the patient to remove their mask if they're able. I would put the patient in a position of comfort, make sure they have everything they need, their bed is locked, whatever they need. Then I would document what I did and perform hand hygiene and leave the room.